get ready to take control of your healthcare. Here's your host, Ray Kober.
And we're live. Ladies and gentlemen, welcome to Broken Healthcare. My name is Ray Kober. I am your host, and I'm sitting here with David Kinsey of TempoPay
and PayMedix.
We're live from Ascend. This is the 10th anniversary of the Ascend conference. And how's the conference treating you?
It's been great. Nelson and his team put together a great agenda, and I'll applaud them for handling the exhibit hall slightly differently. It gives us 2 minutes to give a pitch.
Yeah.
That's all I need. I know we have 10, but give me 2 and I'll get the message across. So.
Well, so the idea of this is kind of a lightning round. So
yeah.
we typically do long format. This is something that's a little new for us. But tell us a little bit, David, about your background and, how'd you get involved in this crazy industry of ours to begin with?
Oh, absolutely. So I came from the side of the house that everybody in this room is trying to beat.
Okay.
I worked for the Bucas, and I am so happy to be trying to solve for something completely different and needed.
Okay.
So it was a great background, but excited about what I'm doing now, which is we're trying to solve for, and I saw you have some stats on your website as well.
Yeah.
So this will be very familiar to you.
Yeah.
But we're trying to solve for the 60% of the U.S. population that can't afford a $1,000 out-of-pocket expense.
Yep. Yeah. Statistically, they most Americans have less than $600 saved for a rainy day.
Yeah. Another stat was, it used to be we'd say $400. It was like 49% couldn't afford $400.
Yeah.
And everybody knows deductible co-insurance.
Sure.
These are the same people that are avoiding care.
People living paycheck to paycheck.
Exactly right.
There's no money left in their savings, in their bank account to pay for a huge healthcare expense in the event that it happens. So how are you solving this problem?
So we do it one of a couple of ways. With TempoPay, we provide a interest-free line of credit that's offered by an employer group.
Okay.
That can be used to cover the cost, the out-of-pocket expenses for medical expenses, pharmacy expenses, have the option of turning on dental and vision as well, and even veterinarian care.
Oh, wow.
A lot of employer groups, they take the attitude of, I look at it from a total wellness standpoint.
Right.
If I have employees that are upset because they can't afford to take their pet to the veterinarian,
right,
they may be out of work longer.
Sure.
So we have the ability to solve for that as well.
Okay. And so how does it work? Let's say we're, dealing with one of those employees that doesn't have $1,000 saved for a rainy day, and crisis hits. They get hit with their share of the expenses, $1,000.
Yeah.
That's their deductible. They have coverage after that, but that $1,000 that they're responsible for, they can't come up with that. So
that's a great.
So where do you come in?
Yeah, great question. So we start on the front end. We work with their agent, their trusted advisor, and the employer, the benefits team, to come up with a communication strategy to roll out the availability of TempoPay to their employee population. Mm-hmm. It's up to the employee then to download our app, activate the card. Notice I say activate and not apply, because we don't do credit checks.
Yep.
We're allowing people that have a credit score less than 350 to be able to have access to funds. And the reason we do that, we're trying to solve for a problem, right?
Yeah.
Because these are the same people that often when they go to a provider office, and that 31% of providers are now starting to collect payment up front of some type.
Yep.
And their only option may be the high interest credit offering that the provider provides, right?
Yep.
So they download the app, activate it, takes all of 2 minutes to do that. And then they have immediate access to those funds. It's up to the employer and their trusted advisor to decide what they want that credit line to be. And we do it anywhere from on the low end of $500 up to the high end of $5,000.
And so is it regardless of their credit risk? Is there still a credit app for them to go through, or it's not? You take that out of the equation?
Taken completely out of the equation.
And then what would a repayment schedule look like for an employee for a $1,000 debt?
Yeah, we set it up to where we'll work with the employer to have a default, which is typically 6 to 7 months.
Yeah.
But the user, the employee, can actually change that when they use TempoPay, use the card.
Okay.
So they can say, you know what, I want to pay 100% off on my next paycheck.
Right.
Or I want to pay it back in 12 months.
Yep.
So they have that flexibility, but regardless of whether it be 1 month or 12 months, there's never going to be any interest charge.
So I'm going to ask you the obvious question. How do you make money?
Softball. Right. So the employer pays us a per employee per month fee.
Okay.
And that fee varies based off of a few factors. One, what's the credit line?
Yep.
Number two, what services are we including? I mentioned the medical, dental, pharmacy, vision.
Yep.
Each one of those has a lever to it. And how many employees they have. And then the last piece of it is their industry, because we're measuring our risk, right?
Sure.
So if it's a industry that has a higher percentage of lower paid employees, typically below $100,000 per year,
Yep.
and also potentially a higher turnover rate,
Yep.
the fees will be higher.
Got it.
So that's how the math works.
Got it. And when you say fees, it's a per employee per month
Correct.
fee to the employer, regardless of whether or not the employee is using the plan?
That is absolutely correct.
Okay.
We have the ability,
Yeah.
because we do have some employer groups and agents that say, hey, can you do a per user per month fee? We
Yeah.
can do that,
Yeah.
but
Yeah.
the fee is obviously higher
Sure.
at that point.
Sure. Okay. And what type of success are you having?
Well, so we've been doing, crossing over to PayMedix for a second.
Yeah.
We've been doing patient financing for up to 20 years.
Okay.
We had the opportunity to partner with TempoPay and brought them on board as part of our company back last July.
Okay.
So we're still getting our name out into the marketplace.
Yep.
But in terms of our background and our history, we've been doing this for a really long time, and we've seen the great value and the great impact it has
Yep.
on employees, their ability to get care,
Yeah.
and also the ultimate impact on utilization. Because in Wisconsin, where we started, we're headquartered in Milwaukee.
Yeah.
We have a provider network that has patient financing embedded into that network, and we have 19 TPAs that use our network today. And we're competitive with the BUCAs in the marketplace.
Yep.
And the reason is because the providers love the fact that they're guaranteed that they're going to be paid the patient responsibility. And that's what PayMedix does.
Got it.
But back to the utilization stats.
Yeah.
Our trend runs, our medical trend runs 2% below market average.
Okay.
So we're bringing the cost curve down,
Yeah.
and people with a credit score of less than 350 are accessing care at the same rate as individuals with a credit score of 650 or above.
Right.
Thus, people are able to get the care they need when they need it
Right.
versus delaying it.
Right. Right. Interesting. So it sounds to me like you're really leveling the playing field for the employees regardless of their credit risk.
That's right.
And you're assessing the risk of each group based on the industry that they're in, the employee salaries, et cetera, et cetera. So it's not a one-size-fits-all, is what I'm hearing, if that's correct.
Only that the fee will change
Yeah.
based off of the makeup of the different employee group, but it's not a significant change.
Right, right.
And one of the things I didn't mention yet, from an employer standpoint, one of the top questions we get is, what's my liability when the employee leaves my company?
Sure.
Zero. It's the responsibility is upon us to work with that now ex-employee to set up a repayment plan.
Got it.
To get any funds that they still owe us.
Got it. And so, what's your track record? Like, how are you able to track those funds down, those employees down, and get repaid?
Yes, we actually do, and we take a very kind approach to the process.
Yeah.
And we do a better job than most companies in
Right.
terms of our collection capabilities.
Right.
And keep in mind, when they're employed,
Yeah.
our preferred method is through payroll deduction, although we can do personal bank account
Sure.
if an employer wants us to do it that way.
Sure.
But as long as they're employed, we'll be able to recoup the funds.
Right. You'll facilitate the process, and I think the idea is to take the pain out of the pain, of paying. Right. So it's really you're kind of providing the employees with a soft landing and a way to maybe have a procedure that's needed, whereas otherwise they might put it off. There are other, implications there in terms of how that impacts their work performance, et cetera, et cetera.
Yeah,
So,
improving presenteeism at work, lowering medical trend. I'll give you another stat. everybody watching, you've all walked into a pharmacy, doesn't matter what pharmacy it is, and you see a ton of bags on the counter, on the shelves in the back.
Yeah.
25% of prescriptions that have been filled never get picked up because of financial concerns.
Yeah. Yeah.
So that's another thing that
Sure.
we're solving for. It gives
Sure.
people a budgetable way to be able to get the prescriptions.
And
they
so
need.
the feedback that you're getting from your clients, do you have good persistency rates? I don't know if you do net promoter scores or anything like that.
Our persistency rate is 95% retention of our customer base.
Okay.
And our NPS score, it's been a while since we've actually done one, so it's a little bit old, but 75 for NPS.
Yeah.
And we had a recent customer satisfaction survey that was 90%.
Okay. Interesting. That's an interesting solve. I mean, not everyone is in the space doing what you're doing. I don't know what the competitive landscape is, but you're finding success, and that's awesome.
Yeah.
That's really what it's all about. I think, this $5 trillion healthcare system that we have has got a lot of moving parts and pieces. And I think a big piece that is often overlooked is the ability of a patient to pay, and how that not only impacts, the finance of healthcare, that's one piece of it, but how it impacts their overall health, their quality of care, their quality of life. And so I think it's an interesting solution, and certainly one that, I would imagine if we're talking about higher income employees, the IT sector, et cetera, those are probably not the best candidates for your solution, although they may exist. But for maybe lower paying jobs, if we're talking about manufacturing, labor intensive stuff, that sort of thing, what you're doing is a true service that could be a game changer.
Yeah, Ray, I'll add one item to comment in response.
Yeah.
Even for the employer groups with higher paid populations, these are the same companies that likely have high deductible health plans with health savings accounts.
Yeah.
Now we get into a culture conversation.
Yeah.
Does that employer have a culture around, I want people to be able to save for retirement, and I truly want them to use their the HSA as a health savings account versus a health spending account?
Yep.
That's where we come in.
Yep.
I don't know about you, but when I go buy an appliance that costs $2,000 and they're offering free financing for a year, sign me up. Right?
Yeah.
It's an easy way to just budget it.
Yeah.
That's kind of where we come in, even with a high paid population.
Yeah. Awesome. Well, hey, David, thank you for stopping by.
Yeah,
thank you for educating us. And if they want to find you and learn more about this, what's the best way to find you out there?
So www.TempoPay.com.
TEMPO pay.com.
.com.
Okay.
And you can just send a note through our Contact Us, and it comes to me, and I'll be happy to help you out.
Are you on LinkedIn?
I am.
So spell your name for everyone.
David Kinsey, Kinsey. I'm on LinkedIn as well, so you can reach out to me on LinkedIn.
Right on. Well, hey, David, thank you so much for stopping by. I appreciate it. Enjoy the rest of the show.
You as well. Thanks again for the opportunity, Ray.
All right, take care. Love always, baby. Peace out.
All right, that's a wrap. Hit like, follow, and subscribe, and we'll catch you next time.